Hello, everyone. My name is Allison Woodard, and I am the team leader for Team 2 for our Nursing 400 final project. Our team members consisted of Michelle Bush, Robin Lemoyne, Mallory Love, and Tana Rhodes. The scenario provided is a 30-year-old female who is 33 weeks gestation and brought into the OB clinic by her significant other. She reports having severe epigastric and right upper quadrant abdominal pain, decreased urination, a horrible headache, as well as seeing spots. She is also positive for opiates. Her home medications include 2 vitamins, 1 thyroid hormone, 1 antihypertensive, and 3 antiviral medications. According to the information provided for this case study, we can assume that the patient has a history of hypothyroidism, hypertension, and HIV. These assumptions can be made due to her list of home medications. She is taking Synthroid, which is used to treat hypothyroidism, Aldomet, an antihypertensive, as well as 3 antiviral medications that are used to treat HIV. According to the Cleveland Clinic, preeclampsia typically develops after 20 weeks gestation, and the symptoms include hypertension, protein in the urine, headaches, right side abdominal pain, swelling of the hands and face, shortness of breath, blurry vision, light sensitivity, and dark spots in the vision. Severe preeclampsia may include decreased kidney or liver function, fluid in the lungs, low platelet count, decreased urine production, and hypertensive emergency. The patient in this scenario is displaying 4 symptoms of preeclampsia, one of which indicates severe preeclampsia. According to the American Addiction Centers, preeclampsia can be a complication of opiate use during pregnancy. The patient is also positive for opiates at this time. A commonly accepted cause of preeclampsia is abnormal placentation, which may induce dysfunctional maternal physiology and lead to placental ischemia, oxidative stress, and hypoxia. Preeclampsia impacts multiple organ systems and may cause extreme hypertension, ending in organ failure. Typically, preeclampsia is diagnosed by presentation of hallmark signs and symptoms of systolic blood pressure over 140 and diastolic over 90, as well as a new onset headache that is unrelieved by medication in patients free of migraine or headache history. Visual changes, epigastric pain, or right upper quadrant pain with nausea or vomiting may also be noted. The presence of one or more of these symptoms is cause for a thorough exam. Patients may also present with shortness of breath, increased swelling, dizziness, changes in reflexes, and decreased urinary output. The patient in this study is displaying classic signs and symptoms of preeclampsia. It is noted that diagnostic testing is imperative in diagnosing preeclampsia. It is important to rule out conditions with similar symptoms, such as chronic hypertension or gestational hypertension. Lupus, seizure disorders, and chronic renal or liver disease are also possible conditions. The patient in this case study presents with hallmark preeclamptic symptoms requiring immediate medical attention. Depending on the severity of preeclampsia, early delivery may be considered for some patients in order to prevent harm to the fetus. It is noted that for patients with severe features of preeclampsia, early delivery should be considered at 34 weeks after corticosteroids have been administered for fetal lung maturity. Caring for the mother with preeclampsia consists of frequent monitoring of both the fetus and the mother. Blood pressure should be carefully monitored and frequently treated with either IV hydralazine, labetalol, nifedipine for a goal blood pressure of 140 to 155 over 90 to 100. For the patient in this scenario, There are various orders that will need to be considered to treat both her and her unborn baby. Some of the labs that should be ordered in this scenario would include labs due to hypertension, such as LDH that can determine cell damage, ALT, which may be increased in preeclampsia, uric acid, CMP to assess kidney damage, as well as a CBC, PT, PTT, and fibrinogen level. Since the patient is noted to have HIV, it would also be necessary to check for viral levels, which may be passed on to the baby during birth. Medical orders for the treatment of hypertension in the patient with preeclampsia include a goal of antihypertensive administration. Some of these medicines are the first line treatment when it comes to hypertension. The goal in this situation is to keep the systolic blood pressure below a certain level. If the level is noted to be greater than 160 or diastolic of greater than 100, this calls for medication administration at this time. The first line treatment is to give IV labetalol when hypertension is noted. Secondary treatment consists of hydralazine, and the third form of treatment is to give nifedipine. It may also be necessary to administer magnesium sulfate to prevent seizures for blood pressure noted to be greater than a certain level. There are several different nursing diagnoses related to the mother with preeclampsia. The first nursing diagnosis is decreased cardiac output, with expected outcomes of the client to remain normotensive throughout the remainder of the pregnancy and report decrease in the level of symptoms that she is experiencing. The patient in this scenario needs to remain under 140 systolic blood pressure and under 90 for diastolic blood pressure. She will also experience a decrease in headache, the spots that she is seeing, and relief of her other symptoms. Our second nursing diagnosis involves the risk for imbalanced fluid volume and the desired outcomes that the patient understands the importance of monitoring her weight, blood pressure, urine protein, and signs of edema, as well as being free from generalized signs of swelling, cerebral edema, hemoglobin and hematocrit levels that are normal, and exhibits no signs of these symptoms. Before discharge, the patient needs to exhibit a decrease in pitting edema, increase in urination, as well as a decrease in weight. Our third nursing diagnosis is ineffective tissue perfusion. Our goal for this client will be to demonstrate normal central nervous system reactivity on a non-stress test, free of late decelerations, and has no decrease in fetal heart rate on contraction or due to stress. Before discharge, the patient's baby will remain free of late decelerations, which are 40 beats below baseline. Our fourth nursing diagnosis is risk for injury, meaning that the client is free from signs of cerebral ischemia and displays normal levels of clotting factors and liver enzymes all before discharge. Interventions for these nursing diagnoses include nursing diagnosis number 1, decreased cardiac output. Our first intervention will be bed rest for the patient with preeclampsia, which helps to improve venous return, cardiac output, as well as renal placental perfusion. Our next intervention will be to encourage leg elevation to help reduce swelling as well as the formation of a possible clot. Intervention number 3 will be to monitor vital signs, which is especially important when monitoring blood pressure and pulse. Interventions for our second nursing diagnoses, which is risk for imbalanced fluid volume, will be to monitor the patient's I&O, monitor the patient's sodium intake, which may lead to swelling, as well as examine clean catch urine daily and check for signs of protein in the urine. Our third nursing diagnosis of ineffective tissue perfusion requires the interventions of advising bed rest and restriction of activity, as well as educating the mother and family on assessment of daily fetal movement and what to monitor for. The third intervention will be to provide a contact number for the patient as well as family members if the mother experiences any decrease in her normal fetal movement. Our fourth diagnosis is risk for injury. Our interventions include emphasizing the importance of patient promptly reporting signs and symptoms of central nervous system involvement, as well as monitoring for liver enzymes and bilirubin levels. The patient will also need to be placed on seizure precautions due to this risk factor as well. Some of the legal and ethical dilemmas in this scenario require special care of the patient because she has HIV. The patient in this scenario may feel that she is treated differently due to her situation. Special precautions will need to be taken by the nurses as well as other healthcare members to secure a safe delivery of the baby. This may require also scheduling a C-section to help prevent HIV transmission during the birth. The American Nurses Association Code of Ethics for Nurses states that providing a major source of ethical guidance for the nursing profession. Many facilities have clinical ethics committees or teams to provide support for nurses and staff that find themselves in care dilemmas. The patient in this scenario was also positive for opiates. Therefore, social services was contacted per protocol for the positive result. The significant other in this scenario is not noted to be the child's father. This may also just be a boyfriend or other friend of the mother. This also poses a safety concern as well if the father becomes involved in the situation. Nurses must have the ability to recognize signs of preeclampsia in their expectant patients in order to provide quality care and positive outcomes. But nurses must also take precautions for themselves to help ensure a safe work environment. And here are our 2 reference slides.